right, 20.2 is detecting cancer. Screening for and detecting cancers. One genetic mutation in one cell, the mother or progenitor cell, can produce cancer, and the daughter cells can reproduce rapidly. But clinical detection is rare for a tumor mass less than 1 centimeter in diameter, which can include 1 billion cancer cells. The earlier and more localized the tumor is detected, the better the chance of a cure. For the 4 major types of cancer, lung, breast, prostate, colorectal, combined, the National Cancer Institute estimates that in 2001 to 16 there will be 772,000 new cases and 133,470 deaths in the United States alone. The ability to find cancers before they cause symptoms like a lump that can be felt and have spread would greatly improve the prognosis for people with this disease. The goal of screening tests is to achieve this outcome. Breast cancer screening. The medical procedures used in screening for breast cancer include examination and palpation, self-examination of the breast following a period, mammograms to record images of the breast on X-ray film, digital mammography to record images in computer code, computer-aided mammography using a laser beam to produce a digital signal that can be processed by a computer to highlight suspicious areas, ultrasound using sound waves to make a computer image of the inside of the breast, particularly to see changes in women with dense breast tissue and to tell the difference between benign fluid-filled cysts and a possibly malignant solid mass, magnetic resonance imaging, MRI, creating detailed images of the breast in different planes, ductal lavage using saline solution introduced through a fine catheter inserted into a milk duct through its opening on the surface of the nipple. The solution is aspirated out and examined microscopically to check for abnormal cells. Biopsy of a suspicious lesion can detect the type of lung cancer. X-rays or ultrasounds are used to guide accurate insertion of a needle into the suspicious lesion. Several national organizations have developed guidelines for the age when screening for breast cancer should be started and how often procedures should be performed. Unfortunately, they are all slightly different, making it confusing for patients. Biopsy. Bio is live opsies to view. Removal of tissue for laboratory examination. Duct, Latin to lead. A tubular structure allowing any fluid to flow through it. Ductal, pertaining to a duct. Lavage. Lavage, Latin to wash. Washing out a hollow tube, cavity, or organ. Mammogram, the record produced by X-ray imaging of the breast. Mammography, process of X-ray examination of the breast. Palpate is a verb, Latin to touch. Examination with the fingers and hand. Palpation is a noun. To examine using the fingers and hands. Progenitor, genitor meaning offspring, pro is before. Founder or beginning of an ancestry. Prognosis, forecasting the probable course of a disease. Screen, for French for examine, to evaluate a group. Screening, noun, the evolution of group. And self-examination, to examine part of one's own body. The medical terms used in screening for and detecting lung cancer are chest x-rays are thought of as the screening method for lung cancer. Frequently, when lung cancer is detectable on chest x-ray, it has spread beyond the lungs. Computed tomography CT scans are more effective at identifying early lung cancers than are chest x-rays. Magnetic resonance imaging, MRI, is being used to screen for lung cancer in high-risk patients. Sputum analysis of coughed-up sputum can be useful and cost-effective method of identifying cancer cells arising from the lining of the airways. Biomarkers are substances released by specific cancers and can be found in blood, sputum, and tissue samples. The blood test anti-malignant antibody screen detect the presence of any kind of cancer and is nonspecific. More specific tests for detecting the presence of lung cancer cells include positron emission tomography. PET scans are expensive and not widely available. They are the most accurate non-invasive tests for identifying the cancer if the cancer is spread outside the lung tissue. Scintigraphy uses low-level radioactive agents that bind to cancer cells and can be tracked by special cameras to reveal the exact location of cancer cells. Bronchoscopy can locate cancers in the linings of the major airways. Biopsy specimens are obtained by cutting tissue, by brushings, or by a washing process called bronchoalveolar lavage, BAL. Mediastinoscopy uses a fiber optic tube with a camera and is inserted into the mediastinum via the suprasternal notch to locate affected mediastinal lymph nodes for biopsy. Needle biopsy of tumors in the periphery of the lungs is performed by inserting a needle between the ribs and guiding it to the tumor with fluoroscopy or CT scan. Brain metastases are identified by MRI and bone metastases by technetium 99M radionuclide bone scans. Staging lung cancer. The tumor node metastasis TNM system is used to stage cancer. T stands for tumor and describes its size and its spread within the lung and to nearby tissues such as pleura, diaphragm, and pericardium. N stands for the spread to lymph nodes around the affected lung. Tumor nodes. M stands for metastasis to distant sites such as brain, liver, and bones. Once the T and M, the tumor node metastasis. Once the T and M categories have been assigned, the information is combined and given an overall stage of 0, 1, 2, 3, or 4. Biomarker, a biological marker or product by which a cell can be identified. Bronchoalveolar, pertaining to the bronchi and alveoli. Bronchoscope is an endoscope used for bronchoscopy. Bronchoscopy, examination of the interior of the tracheobronchial tree with an endoscope. Fluoroscopy, examination of the structure of the body by x-rays. Mediastinoscopy, examination of the mediastinum using an endoscope. Scintigraphy, recording of radioactivity using a special camera. A stage is definition of extent and dissemination of a malignant neoplasm. Process and staging is process of determination of the extent of the distribution of a neoplasm.